My dear scholars, children, elders, brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Once again, we would like to welcome you to Ashra Zainabiyya program here at Masjid Husayn, Leicester. And today is the 38th night of Ashra Zainabiyya. Before I start today's announcements, we have an educational presentation. As you all are probably aware, our dear brother, Husayn Hodgkinson, was diagnosed with sepsis a few months ago. Husayn is a bright, healthy and active young man and has worked for Leicestershire Police for many years. He also recently got promoted to detective. Whilst he was at work one day, he fell ill and initially he thought he had the flu or COVID-19. A few days later, his health worsened and he had an extremely high temperature and started vomiting. He was then later diagnosed with sepsis, which resulted into him having critical open heart surgery. So you can imagine how shocking this was to him and his family. This has been an extremely difficult time for him and his family and the community at large. The management committee have been in regular contact with Ghani's auntie, Husayn's mum, and alhamdulillah, Husayn is slowly recovering. Ghani's auntie asked me that she would like to thank all the community that have called her and made du'as for Husayn's quick recovery. She also thought it would be a great idea to educate the community on sepsis and its devastating effects on the human body, as many people don't even know what sepsis is. So on that note, I asked Dr. Naqvi to do a quick 5-minute presentation on sepsis. So can we please welcome him to the podium with a loud salawat, please.
Par Muhammad wale Muhammad salawat. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. First of all, I would like to thank Brother Imran and the MC for organizing this small talk and to raise awareness for this very important topic, which I believe in, if it's not dealt and recognized at the right time, actually can be life-threatening and ultimately lead to death. And I'll show you some stats on that. So it's a very brief 5-minute presentation just to give you a very brief insight what sepsis is, what signs to look for, and who are the people who are at risk, and what early recognition and diagnosis actually can do in terms of saving the lives and prevent and present multi-morbidity and mortality in future. So next slide, please. So what is sepsis? In simple terms, sepsis is basically when our body fights very hard against infection, so much so that sometimes it affects the vital organs of the body, namely the lungs, the kidneys, the heart, as in the case with the brother, and sometimes it can also lead to infection in the brain. And the signs are very, very critical and crucial. And early recognition, as I'm repeating myself again, is very, very important. And it's just a brief insight for you to know when you need to get medical attention without leaving it for the next day to be seen by the GP. Next slide, please. So some interesting facts. So you'll be surprised to know 4 out of 10 people actually, 4 out of 10 people actually can die from sepsis. So it's a significant high number, 40% people actually can die from sepsis. And I was looking at the research, and in 2018, there were around 25,000 deaths just in UK from sepsis. On top of that, 70% of these cases actually occur in the community, which means outside the hospital. So you can imagine at a place where people actually are more vulnerable not to get immediate help and actually can be life-threatening. Next slide, please. Fine. So sepsis is, as Brother Imran was mentioning, can be like a normal viral infection, can start with the flu, it can be a bacterial infection, can start with a simple cough, chesty cough, throat infection, and fever. But the sign that you need to be looking for, importantly, without leaving it for the next day or to go to the GP, let's say over the weekend, is if with high temperature, if you're having any symptoms of feeling cold and clammy, if you're having unusual sweating, If you are feeling that you're drowsy or someone else around you notice that you're being a bit confused or a bit fatigued, or if you feel that the vision is blurry, or if you feel that basically whatever someone is telling you, you are not being receptive, you're not sort of understanding what he or she is saying. So these are very critical signs that, it's not a normal infection, it's likely something more serious than that. And simple, like people, like elderly people, like people in the community, 65 and above, urine infection, water infection is quite common, can start with a simple pain or burning, dark-colored urine. But along with this, if you have any high temperature, any shivering, if you feel, again, I'll read, if you feel shiver, if you feel sweaty, or if you feel that the surrounding around you, like let's say if you're a normal temperature, but you're feeling unusually hot or unusually cold in a normal temperature, that is again a sign of sepsis. Next slide, please. So who is more at risk? To be honest, all of us are. But the people who are a bit more vulnerable is people who are 65 and above, babies or children less than 1 year of age, people who are on some medication which are called immunosuppressive drugs, like people who have got rheumatoid arthritis, have got psoriasis. Very, very important people who are on insulin and have diabetes, which is insulin dependent. Those people, even a simple nail infection you won't believe can actually lead to quite significant infection and ultimately lead to sepsis. And people who are unfortunately are on a medication for any cancer treatment. So these people are more and more vulnerable than a normal person who are not on these, just to be aware of people they are more at risk of. Next slide, please. So NHS guidelines are very clear. If you're not sure, call them, as simple as that. And I think, alhamdulillah, the community is very, 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 very mature and very, very sensible, I must say. It's just, as I said, a brief insight to let you know and to know the recognize the side effect and the signs and when you need to call. I have mentioned what to look for, but one thing which I haven't mentioned, I just realized looking at the slide is, if you experience any unusual rash, especially I'm talking children under 12 years of age, unusual rash, and if you put a glass on it and if it's not fading away, that is significantly serious. You need to call 999. It's not a 111 thing anymore. It's a 999 thing, because that means you might be having infection, what we call in Urdu, gardan tod bukhar, like meningitis. That's very, very serious, and you need to have antibiotic within an hour to prevent that from happening. And next slide, please. So, just last slide, and just a final thing to say is, just remember the take-home message is in September we learned about sepsis. If you don't remember anything, just remember these 4 key points. Time, which means temperature. Normal body temperature is 36 to 37. I think we all should have the temperature thermometer at home to check it. Anything above 38 with the signs that I've told you, anything below 35 is significant. With those signs, you need to escalate this. Infection, again, chest cough, urine, headache, backache, especially in elderly people with high temperature, you need to escalate it. Mental decline, again, as I said, if you're feeling drowsy, if you're feeling fatigue, if you think, let's say you are fine, but if you think that someone has got a high temperature and he or she looks a bit confused, again, that's not a normal fever or infection, it's something more than that. And extremely ill, as I said, mostly people or parents would say, my child is not his usual self. That is a red flag sign. When the parents recognize that the child is not his usual self, that means it's definitely something more abnormal and normal infection. So we need to escalate that. And I think that is the last slide. Can we go to the next slide, if there is any? Yeah. Thank you very much. And just remember this sign, please. Thank you very much. Bar Muhammad Wali Muhammad Salawat.